When it comes to managing your heart health, you have probably heard about LDL and HDL, the bad and good cholesterol. But here's the thing most people, and honestly many doctors, don't talk about. Your standard cholesterol panel might be missing the full story. But here's the question that I get asked all the time in the clinic. Doc, my cholesterol numbers are normal, so why did I still have a heart issue? Or should I be doing more advanced cholesterol testing? Well, the answer might surprise you, but first, let me share a quick story with you. A few months ago, I had a patient, 52-year-old, active, non-smoker, eats relatively healthy. His regular labs looked great. LDL in the 90s, HDL in the 50s. But he came in after a calcium score showing early plaque buildup. He said, Doc, my numbers are normal. How this is possible? What did we miss? So I ordered advanced lipid testing, and what we found changed everything. Let me walk you through it one by one. Here's the science part. Number one, why routine lipid panel fall short? Well, standard lipid panels include total cholesterol, LDL, which is the bad cholesterol, HDL, which is the good cholesterol, and triglyceride. But they don't tell you about the particle number, size, inflammation, or genetics. That's where advanced lipid testing comes in. So the question is, what are these advanced markers? There are 8 of them here, 8 of them. Number one is ApoB, apolipoprotein P, measures the actual number of atherogenic particles. It is more accurate risk measure than LDL. If you have more particles, that means more opportunities to enter the vessel wall and form plaque. If you have a high ApoB with normal LDL, you're still at risk. Number 2 is Lp(a), genetically inherited, sticky LDL-like particles that promotes clotting and inflammation. It is genetically inherited, so it's not affected by diet or lifestyle, but it carries major risk factor for heart attack, stroke, and aortic stenosis. Out of 5 people, 1 of them has a high Lp(a) and they don't know about it. Number 3 is LDL particle number. Think of LDL as how much cholesterol inside the particles, while LDL-P tells you how many particles are circulating. If you have more particles, that means more damage potential, especially in insulin resistance. Number 4 is a small dense LDL. Smaller particles penetrate arterial walls more easily and are more prone to oxidation. This is very common in people with insulin resistance, prediabetes, and metabolic syndrome. So if you have small, dense LDL, even if you have normal LDL, you carry more danger than fluffy LDL particles. Number 5 is ApoB-A1, apolipoprotein A1. This is main protein in HDL. If you have low ApoB-A1, that means dysfunctional HDL. So this is actually evaluate the HDL protective rule even if you have normal HDL. Number 6 is Lp(PL)A2, lipoprotein associated phospholipase A2. This is enzyme produced in inflammation inside the arterial walls. If you have high numbers, that means more unstable plaque. So it's a good predictor of plaque rupture risk. Number 7 is oxidative LDL, the LDL that has been oxidized and damaged. This carries high inflammation and accelerates plaque formation. More common in smokers, diabetics, and people with poor metabolic health. Number 8, which is the last one, is called remnant cholesterol or non-HDL cholesterol. This is all the cholesterol excluding the HDL, and it captures all the atherogenic particles. This is a strong predictor than LDL when ApoB is not available. So here's the question, why does all this matter? Well, because you could have normal LDL, good HDL, and decent triglyceride, but still building plaque. Why? Well, Because your ApoB is high, your LP little a is elevated, and your particles are small and dense. These don't show up in routine panels, but they matter. So back to my patient. His advanced lipid panel showed normal LDL, elevated ApoB, high LP little a, small dense LDL, and mildly elevated LP PLA2. This explained the plaque despite normal labs. So what did we do? Well, lifestyle intervention targeting insulin resistance. Number 2, starting therapy to lower ApoB. Number 3, omega-3. And number 4, reduced inflammation and tracking progress. 6 months later, not only were the numbers better, he felt better, and most importantly, he felt empowered. Here is when I strongly recommend advanced lipid testing. Number 1, family history of early heart disease or stroke. Number 2, coronary calcium score more than 0 despite normal labs. Number 3, metabolic syndrome, prediabetes, and insulin resistance. Number 4, personal history of atherosclerosis. Number 5, you just want a complete personalized risk assessment. This is not just about being scared, it's about seeing clearly and acting early. Here is the bottom line. Number 1, your standard cholesterol panel only scratching the surface. Number 2, advanced lipid testing gives you the real picture. Number 3, you deserve to know if you are truly at risk and what you can do about it. This is what we do here at Dr. Nony's Power Lab. Break down complex health science so you can take action that matters. If you found this helpful, like the video, subscribe to join the community that takes heart health seriously. Drop a comment. Have you had your ApoB or LP little a checked? What did you learn? Let's support each other. Stay strong, stay smart, and let's live longer together. Thank you.